Hi, my name is Jose Atangan, and today I will be discussing about contact dermatitis. Contact dermatitis is the inflammation of the skin that is produced by direct interaction of the skin to a chemical substance. So there are two types of contact dermatitis. The first one is irritant, and the second is allergic. For allergic dermatitis, this is the most common form of T-cell mediated or delayed hypersensitivity. So in this dermatitis, there is a release of the cytokines and the chemokines, the cytotoxins from dendritic cells, and also the natural killer cells. According to Health and Medicine Week, allergic contact dermatitis remains an important comorbidity and a potential exacerbant in the clinical practice. So the most common allergens include lanolin, neomycin, formaldehyde, lactone mix, composite mix, and fragrances that are commonly found in the patient's personal care products. For the irritant contact dermatitis, it is a common non-immunologically mediated inflammation of the skin. The intensity of the inflammation is related to the concentration of the irritant, the exposure time, disruption of the skin barrier, and age can also be a factor. So the most common clinical manifestations of contact dermatitis are erythema, rashes, swelling, itch, and vascular lesions on the area of the allergen can also occur. For the pathophysiology, so when the allergen comes in contact with the skin, so the allergen will then bond to a protein carrier, and there will be a formation of a synthesizing agent that will trigger the Langerhans cells or the dendritic cells. There will be an activation of the T cells, and the T cells will then release the cytokines and the chemokines. There will be infiltration and inflammation of the leukocytes, and we will see the manifestations of dermatitis such as erythema, itching, and vascular lesions. Plan and treatment. So the first line of treatment is we need to identify and avoid the irritants and the allergens. And then next is if ever a patient comes into contact with an irritating substance, it is very important to make sure to rinse the skin with mild soap and water. Also, application of cool, wet compress will help protect the skin and prevent the patient from scratching it. And also wearing a soft cotton clothing will help avoid the irritation. And obtaining a patch testing to confirm suspected diagnosis of contact dermatitis may also be done. So there are studies that show the history and physical examination alone are not adequate to consistently and fully evaluate a patient's contact allergen. And applications of emollients are helpful to restore skin barrier function and prevents painful cracking. We could also start the patient on a corticosteroid ointment to reduce inflammation and heal the irritation. Also, oral histamine may be prescribed for severe itching, and the patient, if the patient is requiring a systemic treatment, then we probably need to refer the patient to a dermatologist for further eval and treatment. So that concludes my presentation. If you guys have any questions, please just type a comment on our comment box. And thank you for listening. And these are these are all the references that I used for my presentation. Thank you.